Microbial diseases of the respiratory system. There are two main parts to our respiratory system, the upper and the lower. The lower starts with the trachea into the bronchioles and bronchi, which is this tree-looking piece right here, as well as the alveoli, which are what make your lungs up. The upper is going to be your nose, your nasal cavity, your mouth. The pharynx, which is the back of the nose, the back of the mouth, and the upper part of your throat. The epiglottis, which is this little flap right here. This is the thing that flaps over and covers your breathing tube when you swallow. And then the larynx. The larynx is the voice box. It's where your vocal cords are. And it sits right above the trachea. When I was in school, I used to get larynx and pharynx mixed up. What I finally learned to do was go la, la, la. Larynx is your voice box, as in somebody singing. It's just kind of a way to remember it. Since the respiratory tract is the most common portal of entry, it actually does have quite a few defenses. In your nose, you actually have nasal hairs. Nasal hairs are covering the hole that makes your nose, so that when you breathe in, if anything comes, it gets trapped on those hairs and hopefully doesn't go in. The ciliary escalator. What does an escalator do in real life? Carries things from the bottom to the top, one floor to another. I'm going to describe something and then I'll explain a little bit better. Everybody's probably seen a concert or gone to a concert where there's been crowd surfing. When people are crowd surfing, do they actually move with the person that's surfing? Do they carry that person? No, they don't. They pass them along. Yes, they go over their head, but the person is up here and all they do is they use their hands to pass them along. This is what your ciliary escalator is designed to do. When I was little, I have 3 older brothers. When I was little and we would get pixie sticks, if I didn't eat that pixie stick really quick, I didn't get a pixie stick. So I learned to quickly eat the pixie stick. And when I was really little, I tried to inhale it and that didn't work out real well. So pixie stick is a thing with the sugar in it, flavored sugar. Yeah, right? When you choke like that, normally it's not, I'm choking and once I'm done coughing, it goes away and then I don't choke anymore. Usually, and you go, okay, I'm fine. 20 minutes later, you're, right? 20 minutes after that, yes? All right, why? Well, when I inhaled the pixie stick, the dust actually went from up here all the way down. It didn't just stay up here. It actually traveled because I breathed it in. The parts that got stuck on the cilia, these little parts of my cell that push things along, will actually get trapped in the mucus, and then the cilia slowly work this up so that it doesn't stay there. I don't want this to stay in my lungs, so I want it to come out. The first coughing fit I had was probably the stuff that was right here. But after I cleared that area, the cilia that were down here have been working to get what's down here up. So after 20 minutes, when I feel that in the back of my throat, it's because they've actually worked up what was there. Now, imagine it in floors, I'll say. So the first floor was here, the second floor was here, and after 20 minutes, the second floor has come to the entrance. So I go, and technically I have 2 options. I can spit it out and it's completely out of my body, or I can swallow it, in which case it goes to the acid in my stomach, and hopefully if there's any type of bacteria on it, it gets killed. So second floor is here. By that point, what was here has worked up to this position, and then this works up. So for like an hour, you're constantly clearing your throat and you're, I'm okay. And it's because this escalator has been working what has been trapped in the mucus in your trachea up so that it doesn't go into your lungs. So that's the ciliary escalator. That here is ciliary escalatory. It's the same thing. The mucus. The mucus itself is sticky, so things stick to it, meaning that if you're floating debris in the air and you go down into my respiratory system, you get trapped by the mucus and hopefully don't go any further than the very beginning of that track. Macrophages. You do have fixed macrophages in your lungs. So if things actually do get past the trachea, past the bronchi, and into the alveoli, these air sacs here, they get eaten by the macrophages that are present. IgA, we talked about the different types of antibodies, and we said that IgA antibodies are in the saliva, they're in the tears, they're in the mucus. Now, just like every other part of our body that is exposed to the outside, we do have normal biota that exist inside of our lungs. That normal biota will fight for territory if anything invades. So the microbial diseases we will be discussing, there are some that are exclusive to the upper respiratory tract. Pharyngitis, rhinitis, or the common cold, and diphtheria. However, there are other diseases that affect both the upper and the lower respiratory tract. Influenza, pertussis, tuberculosis, and pneumonia are all examples of that. Pharyngitis is inflammation of the throat, aka a sore throat, and it can be caused by several different agents. It's not exclusive to one. The reservoir, kind of like with other things that we discussed that can have multiple causes, it depends on which one it is. But typically, if we were to go with the law of averages, it's only humans. The transmission route, generally it's airborne. We are going to breathe this in, but it can be direct or indirect depending on the specific agent. More like if I'm drinking out of a soda can and I have pharyngitis and my friend drinks after me, that might be one way that this can transfer from one person to another. But again, it depends on the specific agent. So signs and symptoms. The throat is going to be red and inflamed. You will have reddened or swollen mucosa in that throat. Tonsils, if you have them, will be swollen, which, hello, I just had tonsil surgery January 7th. Foul smelling breath. Usually if somebody has a throat infection, there's a very distinct odor to it, and there can be white packets on the walls of the throat. People usually say there's pus in their throat. In the case of pharyngitis, it's usually caused by some type of strep infection. Causative agent, as I said, it varies, but if we're talking about the most common things, the common cold virus, Fusobacterium necrophorum was just recently identified as a very common cause of pharyngitis. Streptococcus pyogenes causes about 30% of the cases of sore throats, and that specific agent, Streptococcus pyogenes, actually does have varying virulence factors depending on which one you get. The pathogenesis, how do we get it? Well, it enters into the respiratory system, and there's a local infection of the mucosa of the throat, or the pharynx. Treatment. Antibiotics, if it's bacterial in nature, it's very easy to get antibiotics on board. If it's a viral cause, though, we're talking about just relieving the symptoms. We give you numbing agent for your throat. If you have a fever, we give you aspirin. Prevention, good hygiene practices, good hand washing. So here's the Fusobacterium necrophorum. Here's the Streptococcus pyogenes. And if you look, here is an example of pharyngitis. You can see this person has a very red throat. It's not just the normal light pink. It looks very, very irritated. Rhinitis. Rhinitis is actually also known as the common cold. It is caused by more than 200 different types of viruses. So when somebody says, I have a cold, you can say which one. There are 200 types. It does exhibit seasonality, meaning there are times of the year that we see more cases. Now you might be going, okay, but why? Usually in the winter time, we tend to spend more time indoors in enclosed spaces because it's cold outside, especially in the north where it snows and it sleets and that kind of stuff and it freezes. They will spend a lot more time indoors in close quarters with other people. That allows this to spread very easily. That's one of the reasons why we call it cold season, because it tends to spread during the times when the environment is cold. The reservoir, humans only. We don't get colds from cats or dogs or anything like that. Transmission route. Well, it kind of depends. There's the possibility of getting it from indirect contact with fomites. If you've got a baby chewing on a block that has a cold and another baby picks up that same block and puts it in their mouth, that type of thing. But airborne transmission is also a possibility. If you have a cold and you're coughing, you're spreading aerosolized water droplets into the air. When you do that, you're basically allowing those infected droplets to get into other people that are nearby breathing. Signs and symptoms: sneezing, runny nose, scratchy throat. Depending on what it is out of the 200 different types, you may have a fever or you may not. But usually it's a low fever. You usually, again, may or may not have a mild cough. Incubation is about 2 to 5 days. In most cases, you're talking about running the course of the cold in 7 to 10 days. It's not something that hangs around for a long time. It's an acute infection. It's very short. Causative agent, like I said, there are over 200 different viruses that can cause what we consider the common cold. Most types of viruses that are involved are going to be rhinoviruses, coronaviruses, adenoviruses, respiratory syncytial viruses. Now notice coronavirus. Yeah, coronavirus existed way before COVID-19 specifically. And it was something that we just went, oh, you have a cold. When we talk about virulence and we talk about pathogenicity, COVID-19 has that in spades. Pathogenesis. The virus enters the upper respiratory tract. It attaches to the nasal epithelium, so up in your nose. And symptoms are a product of the host's response to the virus. The virus isn't giving you extra mucus in your nose. Your immune system is. You're sneezing to try and get that virus out of your nasal cavity. Prevention. Good hygiene practices. Wash your hands. And during cold season especially, practice really good hygiene practices. So this is the coronavirus, the classic one, not the one that we know and love today. This is the rhinovirus, the adenovirus. So in this picture, you can see the inflammation of the mucosa. You can see all of this excess mucus that's happening. As I said here, the symptoms are usually a product more of your immune system than they are of the actual virus itself. Diphtheria. This was once a major problem in terms of illness and death, but we've had the vaccination program that has actually significantly reduced the number of cases in the last 50 years. Again, hopefully this will be maintained. We'll see. Signs and symptoms: sore throat, fever, general malaise. I just don't feel good. What you see though, there's a tough grayish pseudomembrane that forms in the throat. This is kind of a key characteristic. You can see it right here. You can also see it here. If exotoxin is involved, if the thing that you get infected with actually has the genes for producing this exotoxin, it can lead to heart and kidney impairment. Depending on how bad it is, it can result in death. If there's nerve involvement, it can also lead to paralysis. Corynebacterium diphtheriae is the gram-positive bacteria that is club-shaped that causes diphtheria. As I said, it produces a powerful exotoxin, diphtheria toxin, that it receives from lysogeny with the phage. Remember, I can pick up things or I can get it from another bacteria if they conjugate with me. But in this case, this exotoxin that we're talking about comes from lysogeny. A phage picks it up, and instead of transferring the phage's genetic material, it transfers the gene. Pathogenesis, the bacteria enters the upper respiratory system. It targets the mucosal cells of the throat. Symptoms result from the response to the infection. The pseudomembrane, this thing that we're seeing here, is actually a composite of fibrin, dead tissue, and bacterial cells. Treatment: antibiotics plus the antitoxin. Because it's the toxin that can cause these effects, we want to include the antitoxin to make sure that those things can't happen. Prevention: vaccination with the diphtheria toxoid vaccine. It's part of the DTaP, which covers diphtheria, tetanus, and pertussis. This is something that if you get vaccinated, you don't have to worry about. This is what Corynebacterium diphtheriae looks like. You can see it here actually under a microscope. Now look at this kid. See his lymph node? That's a huge swelling to that lymph node. As I said before, you can see the pseudomembrane here in the actual throat itself. Switching gears, influenza. It is a respiratory disease caused by the influenza virus. The flu viruses are named according to the H and N glycoproteins on their surface. That's why swine flu was called H1N1, because the H and the N glycoproteins were one, that specific variant. New strains arise through antigenic drift and shift. Antigenic drift is the mutation of the H and N genes that causes the seasonal flu strains. You know how we have to get flu shots every single season? Viruses tend to mutate very, very quickly. With that in mind, antigenic drift is mutations in these genes. Antigenic shift is the exchange of pieces of the genome between different types of viruses when co-infecting a host. So if you have bird virus infecting a pig host, that genome gets shuffled around. This can cause pandemic strains. This is what causes pandemic strains. The reservoir, it can be humans, it can be birds, it can be pigs, it can be other animals. The transmission route, it can be airborne. Somebody starts coughing, droplets go out in the air, you inhale them. It can be direct contact. My husband has the flu and I kiss him, direct contact. Whoops. It can be indirect contact. Maybe a kid is playing with blocks. I always use that example, but it's kind of the best example. They put something in their mouth, the next kid comes along, puts it in their mouth. Signs and symptoms. It'll usually begin in the upper tract and it progresses lower. You have headache, you can have chills, dry cough. Instead of having something that produces, like you can hear the wetness in the cough, it's just a dry cough. You don't hear anything kind of rattling around. Aches, fever, stuffy nose, sore throat, and fatigue. There is a huge difference between having the flu and having a cold. Having the flu knocks you on your end for a few days. You want to sleep, you hurt, your body is just achy as all get out. Having a cold, yeah, you might get a cough and your head feels kind of stuffy, but normally you don't get a fever. You normally, don't have body aches. And with a cold, a lot of the time you can work through it. You can have a cold and still go to work. Flu, you feel so bad, you're probably not going to be going to work. The causative agents. This can be influenza A, B, or C viruses. They are members of the Orthomyxoviridae family. They have glycoprotein spikes that help in the attachment and the life cycle. Just like with every virus, they've got spikes that they use to gain access to your cells. H is hemagglutinin. N is neuraminidase. The genome is segmented on different strands. That means that it allows for a lot of reassortment. The virus enters the body. Okay, so the pathogenesis. The virus enters the body. It binds to ciliated cells in the respiratory mucosa in the lining. It causes what we call a cytokine storm of immune responses. That storm is what leads to our symptoms. Again, it's not really the virus causing our symptoms, it's our immune system. Treatment. There is Tamiflu. There are some other treatments that are designed to block the life cycle of the virus. But in order to have any efficacy at all, they actually have to be taken immediately in order to work. The minute that you start taking it. It's not one of those, I've had it for a few days, by that point it's too late. Prevention. Well, we know that we have flu vaccines. So kill injected vaccines or inhaled live vaccine can be taken annually to offer protection against new strains, and because 3 years is the maximum length of protection for the flu virus. Because of how quickly this mutates, because of how fast this mutates, we have yearly vaccinations, flu vaccinations. Now, mind you, there are a lot of variants of the flu. So they kind of choose the top 10 and they put that into the vaccine and you get vaccinated for it. And they say, okay, these will be the top 10 for this year. If you still get a flu, most likely it was not one of the ones that they picked as one of the top flus for that season. It happens. I wish it didn't, but it does. So yeah, still get it though, because in some cases, the one vaccine may help prevent 50 flus. So there's no reason not to get it. And remember that most of the time when you get vaccinated, it isn't the vaccine making you sick. It's your immune system making you feel bad because it's fighting its war against the thing that was injected into your body. So here is the influenza vaccine. The symptoms: fever, aches, chills, tiredness. Usually it has a very sudden onset. It's not something that, you've been feeling bad for a few days. Usually you get sick real fast. Central nervous system, you have a headache, systemic fever, but it's not the low-grade fever we see with a cold. This is going to be a high fever. Muscular-wise, there's extreme tiredness. We don't feel good. The joints ache. With your nasopharynx, your throat, and your nose, you get a runny and stuffy nose, sometimes a sore throat. Again, it can ache. Respiratory-wise, you get coughing, but again, it's not a productive cough. It's a very dry cough. You cough, but there's no mucus or any phlegm or any wetness to that cough. Gastric-wise, you may end up feeling like nauseous, so you vomit.